Good morning. We're going to get started. I have the pleasure of introducing Dr. Kwast. He is a MAC President's Club member, a chiropractor and certified strength and conditioning specialist who serves as CEO of Peak Performance Integrative Medicine and Eye Care Clinics in Grand Rapids. His multi-location, multi-million-dollar practice focuses on function-based care and patient education. A graduate of Palmer West, Dr. Kwast is known for translating complex clinical concepts into clear, actionable strategies that improve patient outcomes and practice performances. It was his own struggle with migraines and the relief that he received through chiropractic care that encouraged him to study and practice chiropractic and natural health care. Dr. Kwast received the Palmer West Clinical Excellence Award in 1998 and is a member of the school's Pi Tau Delta Honor Society. Ladies and gentlemen, it's my pleasure to introduce Dr. Michael Kwast.
Thank you. Thanks, everybody. Appreciate your time. Today we're going to talk a lot about stuff that you can implement not only like in theory, but this is stuff you're going to be able to take home and grow your practice. Because the reality is, it doesn't matter how good you are, if nobody knows about it, then you're teaching at the school with no clinic, and that's that. One of the best adjusters I ever had, Robert Cooperstein at Palmer West. That guy was magic, but where was his clinic? Nowhere, because he can't speak English to people. He speaks English, but he talks in a way that no patient can understand. A brilliant mind, but not good in the marketplace. So we're going to be talking about the marketplace and how you drive patients to come in and how their understanding is essential to actually getting results. I've written 2 books, No Rocking Chairs, 7 Beliefs Destroying Your Health. Both of these, who do you think I wrote them for? You? Who? So this is where we call this the class participation, right? Wrote it for patients, right? So one of the things we're going to talk a lot about too is what market are you playing in? Are you in the chiropractic sandbox, or are you in the marketplace where all your patients live? And if you haven't guessed it, you want to be where all the patients are, because that's how you grow a clinic and that's how you actually help people. These books, the 7 Beliefs, those were the same things you hear all the time over and over again from patients. And it's all the excuses, the things that they believe in their mind that are just not true. One of them, masking is fixing, right? People think that masking a symptom is fixing the problem. They think that. They think that their problems are from age. Another one. They think that their problems are all genetic, right? And we know those are not true answers to people's problems. Why do they like the age and genetics problem? Because you can't do anything about it. It disempowers you as a patient. So woe is me, I'm a leaf in the wind, getting blown around, and whatever happens, happens. And they like that to put you on drugs forever, because then you don't push back. So we got to get people woke up. We got to try to think about all the things that we can do. I'm pretty passionate about this for one reason. When I was a child, I had horrible migraine headaches. So bad, I was puking my guts out, I would miss school, I would have all kinds of problems. Psychologically, it was very burdensome as a child, being sick all the time. At school, kids would make fun of you. My parents, I remember, they were arguing because my mom's like, I'm going to lose my job because I have to go get this kid every other day at school. And my job's not liking that I'm leaving all the time. It was very stressful as a little boy. And nobody could figure out what was wrong with me. All they did was put me on drug after drug after drug, which came with a whole new set of problems on top of headaches. Thank you very much, right? All the side effects. It was so bad they decided that it must be MS, so they're going to put me on MS experimental medications. So here I am, just a little kid. We happened to go to the dentist one day, and my mom and dad played euchre. All the Michigan people here with our euchre players, they played euchre with this dentist, And so they were kind of friendly. So she was kind of talking about my situation with him just in conversation. And he's just cleaning my teeth, and he goes, well, hold on a second. And he came over and he started feeling my jaw, and then he started palpating my neck and moving it around. And he goes, you don't need to do that drug stuff. You just need to send him to the chiropractor. And my mom was like, oh no, those weirdos, you know, we're not, those guys, it's witchcraft and all, we're not doing that. And I remember the dentist said, he goes, well, let me just ask you a question. Is what you're doing working? And I remember very specifically my mom sitting there for a minute, and you'll see this even with patients when you ask them questions where they'll freeze and the gears are grinding in there as they're trying to figure it out. And then she goes, no, nothing's working. And he goes, huh, maybe you should go check it out and see. So we did, and anybody, George Kaufman's not here. Is he still alive from Kalamazoo? Do you remember old George Kaufman? AK extraordinaire. He's like this tall, and he was like 200 when I went to him, but I saw him, he was here. Anyway, we went to him every other day for about 6 months, and then guess what? No more migraines. Greatest thing ever. Magic, unbelievable. And he was weird. He did weird stuff. He did AK stuff, which was kind of weird, right? When you're step out of your mind for a second. I'm going to ask you to do this a lot today. I'm going to ask you to step out of your mind and what you know and forget and step over and become a patient who knows nothing, because that's who you're talking to. The patient who knows nothing. So here you are, and George is pushing on me and doing muscle testing, and then he'd say things like, count backwards from, 10 to 0, and, okay, and then he would, and then, bam, your atlas would shoot across the room, come off the wall and come back in, and that's what it was. And he had a lot of weird things. He'd have you like hum tunes. He'd be like, hum a tune. And I'm like, I don't know any tunes. He's like, no, a tune, like Yankee Doodle Dandy. I'm like, I don't even know that. What is it? Like, anyway, just there was a lot of weird with it, but it got results. Did I know how it worked? Nope. Did it matter? Nope. I still got results. If I hadn't done that, just think about this, and this is what we call futuring, and I'm going to ask you to learn how to do this with your patients. Futuring means looking into the future. What would have happened to me if I would have just went on those MS meds? What do you think? Go in a good place or in a bad place? It would be in a freaking hellhole. That's where it would be. And so I'm pissed about it. So anybody have teenage boys? Or had? Yeah, so now I get a little older. And what happens? You get a little cocky and mouthy. That's what you do. So now I'm cocky and mouthy. So now I go to my family doctor and I'm like, hey, yo, what's up, man? Why didn't you tell me to go to the chiropractor the first day I had a friggin' headache? And instead of all these pills. And he goes, well, what do you mean? He goes, I don't know anything about chiropractic. And I'm like, remember, you got to become a patient who doesn't know. So when I was a kid and a patient and I didn't know, what did I think doctors knew? Freaking everything, right? So I'm like, what? My gears are freezing and what? You don't know everything? You know everything. What the hell? Every TV show, Marcus Welby, he knows everything. Every show, all the doctors know it all. And now you're telling me you don't. So now I'm like, say what? I go, what do you mean? He goes, I don't know anything about that. He goes, I've been trained in drugs, medicines, and some minor surgeries we do. That's what I do. That's what I know. And he goes, but boy, that's really working for you. No, and he goes, you need to just keep doing that. And I'm thinking, you got to be kidding me. I was waiting for him to tell me that, like, directly when I first had a headache, and he wasn't even on his radar. And I asked him, I go, what do you mean you don't know? How do you not know? And he goes, listen. He goes, son, listen. There's doctors for every part of your body. There's a specialist for every part of your body. Any part. And he goes, the funny thing is, when you put the specialists all in a room together, you know what they do? It'll be just like us in a few minutes here. What do they all do? fight and argue because nobody can agree. They all fight and argue about everything, which you're going to want to do with me too. So that's just how it is, right? Especially chiropractors. It's like herding cats. Like nobody can agree on anything. Like it's crazy. But anyway, so I walk out of there going, holy crap, doctors don't know everything. Specialists even don't, and they argue. And nobody's got chiropractic on the radar. And it just saved my life. How many other kids are out there suffering like me, but they're not getting the help, and they're going down a bad street of drugs and possibly even experimental drugs. So if you don't think communicating to the public matters, I'll punch you in the face out in the parking lot, because it does, because that was me. And what really annoyed me was my family. This really annoys me. My family, once they found out, oh, you got help with chiropractic, then they suddenly what? They knew it. Oh, I knew that would help you. Oh, what? And you didn't say anything? Where do you want to get punched first? Like, who does that? Oh, I know how to help you, but we're not going to do it. We're just going to watch you suffer and eat popcorn. Holy hell. That's insane. But this is what people do because they're afraid. They're afraid to say something because they don't want to be wrong. Or they're afraid that you're going to go into the place and he's going to ask you to hum a tune and count backwards. And, you know, who knows what you guys are going to do to the patient, right? So people are scared and they just don't know. Now, this story I just told you just now, that's my story. Do you think I've told it before? Yeah, if you don't have a story like that, you need to create one. Because when you go places, you should lay that out and you practice it so that people can understand it. When I do that story, I've done that story on TV. The phone rings and people are like, son of a gun, I gotta come in, the same thing's happening to me. They're trying to put me on all these meds and I need something natural. But you got to have a story for yourself because that's what you want to tell your patients. What else does it tell your patients? It tells them your intention. Because what does a lot of the public think our intention is?
Keep you coming back.
Keep you coming back for what reason?
Money.
Money, right. Like, oh, aha, gotcha for another $18 visit from Medicaid. Ha ha! Going off to retirement on my $18. Hasta la vista. It's a freaking joke. That is not going to put anybody into retirement. Are you kidding me? It doesn't even make sense. We don't make money in this profession with what they pay us compared to all the other healthcare providers. So for them to think it's about money is the dumbest thing I've ever heard, and it's a joke. Can you make money? Yeah, we can all make a decent living, but is it like a pharmaceutical sales rep? Not even close. They just show up at the doctor's office with samples and free lunches, and they make tons of money putting people on meds. So if that didn't fire you up, then you're in the wrong profession because it's purpose-driven. We have to be purpose-driven on this stuff or else you will get burned out too fast. Anybody that's been doing this for a while, I've been doing it since '98, do I get burned out? Yes. Do I sit there and want to, like, in my head curse? Yes. Sometimes out loud too. And I will, so sorry. Not sorry, but sorry. So think about the things that you can do with your own story. Any of you have a story already that you already do this with? All right, so you got homework. There's step one. You do that and you go to your chamber, you go to a networking group, you go somewhere and you tell that story. You're going to get new patients. Hashtag you're welcome. That's how you make it happen. Now, that story is super important, and I want everybody here to really think about it and see what you can do, because you can probably come up with some really good ones, because a lot of you have fantastic stories. And people need to hear those. There's a book about storytelling, how it helps get ideas and concepts. Now, here's a few things I want to show you just to make you mad and try to boil up some purpose in you try to get you to participate a little bit and not just be here for the nap of the 3 credits you're going to get, because we got to come to these things and get credits. I'm going to do something that's going to make you have a difference. So when you go home, you're actually going to get something out of this if you can just stay awake and stay with me for the little bit of time we got. Number 1 cause of acute liver failure. This is another story that I do when I go to lots of places. I've spoken at hundreds of companies, lots of different places I go, and I always ask the crowd, what's the number 1 cause of acute liver failure in the United States? And they always say, drinking. Booze, right? Remember, don't think like a doctor, think like the people. You got to be the people now. They think it's booze. And that, nope, booze is safer. It's Tylenol. And every one of them's got what in their purse or pocket? Tylenol, and they have no freaking clue that that is even risky. Some of them even take more of it now after Trump said it was bad. What you gonna do, right? So people don't know. So they think that taking this is no big deal. It's no big deal to just keep taking Tylenol. It is a big deal. Lifetime damage. Have at it. Congratulations on your consequences, right? So a lot of what we're doing is trying to help people see the future of what their choices lead. As you know, I have many patients. I've seen we just added it up the other day, over 10,000 patients I've seen. Some of you old guys have seen more. But here's the patterns that we're seeing, and that's what I'm trying to lay out for you so you can see the patterns so that then you can get in front of it and do a better job. But this acetaminophen, this Tylenol thing, people don't realize. So then you ask the person, and this is called futuring. What's your name? Craig. Craig, what do you think happens if you take Tylenol for the next 30 years every day to your liver?
Fail.
Is going to work better or worse? Worse, yeah, it's going to fail. It's not going to be as good. What if you could do it naturally over the next 30 years and not take that? Do you think your system would be in a better place?
Absolutely.
Now, he's done. He came to the conclusions. Did I lead him there? Yeah, but it futured it. A lot of people don't think about the future. They're just doing this. One foot in the other. I just got to get by today. I just got to get by today. Got to get by today. Anything I do, I got bills to pay. Kids are crying. Wife is mad. I just got to get through the day, man, through the day. And they're doing whatever they got to do. So it's not that they're dumb or anything like that. They're just poor people trying to get through. And they just don't know what to do because we all haven't talked enough. We haven't got out in the community enough. There's people out there need you. I have a networking group called BNI that I go to for 20-something years. Every Friday morning at 7 a.m. downtown, I got to haul my ass down there. And are there days I don't want to? Yep. Yesterday was one of them. Because I had to come up here. I mean, that's going to be a long day. And then what makes me go? There could be a kid who has headaches and has problems, and he's going to be, his connection is going to be in that meeting. How dare me not show up? You better care. How dare me not show up? I have to show up because somebody might need me, and somebody needs you. Every one of you right now, there is somebody in your sphere of influence right now who is suffering with a health problem and they don't know what to do, and you are the solution. And they just don't know. And are you going to get up to heaven one day and they're going to go, why the hell didn't you tell me? And you're going to go, well, I didn't want to be pushy, and if you wanted to know, you would ask me. That's what everybody says. If they wanted my advice, they would ask me. They don't know to ask you because they don't even understand what we do, even a tiny little bit. And I'm going to show you some of that in a minute because it's crazy what people think about us. Oh boy. So here's another interesting thing. So you always see all these homeless people roaming around, right? I just went to Croatia. There's no homeless people. And we were in this huge town walking around at night. And I'm thinking, all right, I got to be like situational awareness. I used to work in security, so I'm like paying attention. And there's no riffraff. And there's no fat people. and there's no homeless people. And I'm like, what the hell's going on here? I don't know. Maybe you guys know. Different world, different foods, different things. I don't know. Here's the thing, the homeless people you see on the street, and these, I just Googled these. Why did I Google? So why am I showing you what's on Google? What? Because that's what your patients are doing. You got to know what they're doing. So they're going to go on Google and they're going to, oh, I don't know if I believe that Tylenol thing. I think you're just full of it. Stinking witchcraft guy. And then they'll go, oh, holy shit, he was right. Yep. I know, you don't hear that much. I actually golfed with a guy the other day, and his phone starts ringing, and it says, Dad, you were right. Dad, you were right. And I'm like, what the hell's that? He goes, my daughter one time said I was right, so I recorded it and I put it on my phone. It's a ringtone. 75% they're estimating of the people you see on the street addicted to drugs and pills, and this changed my opinion dramatically, because I'd always be like, get a freaking job, quit being lazy, right? Yeah, no, 75% ended up there because of a musculoskeletal complaint. That what was the solution? Pills. And they got on Oxycontin, they got addicted, and now they're hooked. And then what did they do? They took it away. So now what do? Now you're hooked. If you were in the seminar yesterday about the mind, we're not talking about prefrontal cortex thinking. We're not talking about thought. We're talking about amygdala. Oh, like crazy stress stuff. What's that person doing now? They need to get their fix. What are they doing? They're going on the street and getting whatever the hell they can get to survive. They're just trying to survive. It's sad. So that pisses me off. That means we're not doing a good job as a profession. 75% are still going for the pills. And all those people that are hurting and having problems that we potentially probably helped. And that's just musculoskeletal. Who knows about all the other stuff? Geez, oh Pete, every other person you meet. I don't know if it's just you guys, but I have noticed probably 90% of our new patients are all on some kind of psychiatric med. I think all the crazy people are like in my town. Like, what the hell? Everyone's on stuff. And that messes with you. That messes with you. Here's another one. Look at the consequences of pain. Chronic pain, in particular, leads to a cycle of increased pain, anxiety, negative impact in your mood, your relationships, and your function. Say what? So even people who are like depressed. We used to see, like when fibromyalgia, before they had a drug for it, I had a whole clinic full of fibromyalgia people because there was no other solution, and we got great results. But it was so funny because they'd be like, oh, you've cured me of my depression. I go, listen, what are you talking about? They're like, I don't need that anymore. I go, yeah, right, because here's the deal. If you're in chronic pain every day, you take the happiest person in the world, and we put them in chronic pain every day, how long before they're depressed? And would you call that abnormal, or would you call that normal? If you're in pain every day, you probably should be sad about it. That would be a normal response, right? So getting people to feel and function better will help their mood and everything else. So I'm showing you these to kind of get you worked up, because I'm going to need you to do some things. And they're going to be really uncomfortable because you don't want to do them, because it's going to be called you having to change. And change in ways that you don't like. So it's interesting, when I was teaching with the ProAdjuster group, if we had a new protocol where we could show you, like, oh, look, you do this and then you do this, all the chiropractors would run over. Wow, look at all that. Oh, ooh, ooh, ooh. And then I have another group over here, and I'd be like, all right, we're going to teach you what to say to patients and how to communicate with them better. Nobody wanted to do that. Why? And I asked the guys, I'm like, you guys, it doesn't matter how good you are at this when you got nobody to see. What's the point? You'd be better being like half-ass shitty, but knowing how to talk to people, and you'd get more people better. So why is it nobody would want to go over there and learn this stuff? It's just true. The guy says, I'll tell you why. I go, why? Because he goes, it's too damn uncomfortable. It's way easier to just come over here and watch, go to one of these things and sit there, and you don't change nothing. Or you go in and it's like, oh man, I got to say this different. I got to respond different. I got to look different, think different, do all these things different. And that's uncomfortable for me. I would rather not, right? So you're going to be uncomfortable, but you know what? What's more important, your discomfort or the kid who's having headaches? You got to decide, like, what's more important? Your discomfort? Oh, I don't know if I want to speak in front of people. I don't care what you want and think. There's people suffering that need your help, and you're going to slack out like that? Jeez. Give me the man card. You don't get one. You have to step up for the people. So one of the things, you know, we talk about this stuff at seminars all the time. It's like, everybody's just there to get their credits. And it sucks, and it's all boring, and da-da-da-da-da. Well, I'm going to make sure you go home with stuff. You already got one. Get your story down. Get your motivation down, because people are suffering. They need you bad. In your sphere, you have people. But I don't want you to just be here to get your 3 credits. And you really shouldn't either, because that's just wasting your time. Let's say I could just get my 3 credits, or I could do things that are going to boost my practice, help more people, save people's lives, get them off drugs, get them from having unnecessary surgeries, having a better quality of life, getting to their freaking casket with great mobility and function. Oh no, I think I'll just get my credits. Please. So one of the things, though, that's important is that you become what you want your patients to be. So how many of you do patient education on some level? Because not all of you do. Some of you just go, hey, nice to meet you. Lay on the table, bang, bang, bang. Have a nice day. No education. That does happen. I don't recommend it, but do what you want. We're all a bunch of roaming cats who can't agree on anything. So when you think about it, I need you to be the student that you want your patient to be. Because right now everybody wants to just sit here and figure out whatever's wrong, whatever spelling error I have, my fly's probably open. Like, everybody likes to do that. And no, what you need to do is you need to be the student that you want when you're teaching. That's what I'm asking you. Just be that. When you have that patient that's like, oh my gosh, doctor, that's so interesting. Wow, I never thought of it that way. Why, yes, like, I'm participating, and look, I can actually look in your eyes. What a feat in today's world. And wow, like, isn't that the person that you just love and you're getting all these results with, and it's like fun? Yeah, be that, please. Thank you. Right? Open mind, man. Open your mind. Chiropractors are open-minded most of the time, except when it comes to what we do. Then everybody's 100%. Oh, yeah. Be a little open-minded. You know what? You don't have to like everything I got to say, but you can cherry pick the things out that you do, and that makes a bigger difference to you. So you're not going to like everything. My wife doesn't even like everything I do. So get over it. You don't have to like everything a person does. That's just stupid, right? What kind of utilization do we have in the profession? When I was in school, I think they said 10% back then in the 90s. We haven't really changed much. And I just Googled this. It's like 8.4 to 14%. And so that's weird. We're not really doing a good job of like breaking that. How come? Well, Palmer did a little survey to people. One of the top reasons was people are scared. And geez, if you watch TikTok for 5 seconds, so we think it's cool. Oh, look, they hooked this towel to the guy's neck and hooked it to a horse, and they slapped its ass and it took off and cracked his neck. And we think, wow, that's the cool equine chiropractology. Like, we think it's cool. Patients think it's wacky. Like, people, remember, get out of this and become just a guy. And you look at that and you go, holy shit. Like, That doesn't make you go, oh, I want to do that. Now, if you say, yeah, that's not true, I get people that want that. Yeah, you're right, 8.4 to 14%. They do. The rest are saying, keep away from me with that, right? That's what they're doing. And that's just the reality of it, whether you like it or not. It's just true. So people don't go, they don't like the cost, there's trust issues, they don't feel that they trust us as well, right? There's the big one of perception of need. So how do people think they need care? What do you think? I can almost guarantee you 90-something% of every patient you've seen comes in for a specific reason. It's always symptom driven, right? No matter how good you are. I can't tell you, I mean, I'll get a referral now and then from somebody that'll be like, oh, I don't have any symptoms, but they didn't like call me out of the blue. It was like some referral, the husband or uncle or whoever was talking in their ear, and they got little pieces of the value of what we do and said, geez, maybe I should check that out, right? It wasn't just people on the street doing it. Most people are not. They don't see the need unless they're in pain. And I'm going to talk about you need to shift away from this thought, train your patients away from this thought, because there's something much better than just pain management. Even though that's what the insurance companies want out of us, because that's a really low level of help. So they can still sell lots of drugs, and they can still do lots of surgeries, especially when you do a relief care symptom-based pain clinic where you don't ever really fix the underlying thing. The problems are going to come back, and then what do the patients say? I knew it. Once you go, you got to go forever. They think that. So whether you like it or not, irrelevant, that's the reality that you're living in. People think those things. They think them about me. It's so annoying. So like I'm at this networking event, and I go to them, and I go to the chamber stuff, and guess how many chiropractors are there? 0. Guess how many chiropractors are in my area? I Googled it. About 300. But they're not in the game. They're sitting in their office alone going, I wonder what a subluxation would be if I did this, and then what if I did that? I don't know. What if you did that? Well, if you did that, it would be this. And they're like talking to themselves because everybody's alone in practice. Next thing you know, you're like they, them on your name tag because you got all these people in there talking to you about chiropractic. How many are in there? I don't know. There's a bunch in there. It's crazy. When we look at practices, and this goes back to when I was in school, they estimated, and who's recent grad? Any recent grad in here? What did they tell you what like practice failure is?
I don't think so.
All right. So that shows you how much business we're getting in schools. We're not getting a lot of business, so you all get thrown to the wolves because about half of businesses fail anyway. Chiropractic, same thing. You get people that just don't know how to run a business, so they're out there and they're struggling. They're trying to learn the concepts. And one of the theories that I have is you see guys that survive. They've lasted in practice. So they learn, they figure stuff out, and they improve, they get better at everything, right? And then they get to a certain point, and then what are they going to do? Retire, right? And so then a young guy comes in and says, I'm going to buy this practice. Brings them in, and then what happens? Does the guy that comes in learn any of that stuff? No, so it's like a reset, right? It's a reset. Or the guy in our town, I've seen this happen numerous times, where the guy will buy the practice and go, that old guy didn't know what the hell he was doing. You can't do it this way and this way and this way. You have to do it this way and this way and this way. And they'll change everything. And 3 months later, their practice is out of business because they destroyed the whole thing because they knew better. So it's really weird. They talk about chiropractors eat their young. I'm like, no, the young know everything. The old guys know nothing. And then the young never learns. By the time they realize they don't know anything, they either are working at the college or down at the hospital shooting films because they can't make it in practice. You got to make it in practice. That's how you make the change and difference, and that's how we get these numbers to go up. When you change everything, it's not good. And it's easy. So what we see too is all the people that are sucking, they love to just go around to the other practices that are doing something, and what do? Compliment them and say, wow, those are great ideas. I should maybe emulate you. No, they rip on it. Oh, well, you can't do that because he spelled subluxation wrong. And oh my God, did you see that? That table's from 1982. Like, they want to rip on everything. It's easy to rip on stuff, but I would challenge you to change your mind. And when you see something that somebody's doing that's getting a successful action, you should say, holy crap, I should do that too. And copy it and emulate it. You don't have to think of everything on your own, even though that's what everybody thinks. All the young guys that come into my office are always like, aha! I'm like, what are you talking about, dude? Look at 20 years ago, that's already been thought up. So everybody's like recreating the wheel over and over and over again. Recreating the wheel. And that's not the best way. What's better is to learn this stuff and then get it in a way that people can package it. It's one of the things that I've done in one of our programs, which is this card that you have. We have a learning platform. So when I hire a new person, so what do chiropractors always say when you talk about training staff? You don't have what? Time. You don't have time. What about yourself? I don't have time. What about your patients? Are you educating them? Well, not as well as I could because I don't have time, right? So when we have a new hire, we put them through our learning platform, and then they can learn all the things, what to say, how to say it. What do you say when a patient says this? What do you say when they say that? What's about this objection, that objection? The things that matter in the marketplace. That's what they care about. Those are the things that matter.
Who has the time to teach those people? Was it you or was it your staff?
I did it over the years because I had to, because I didn't have time. We were seeing too many people. And then I didn't have time. So then you would half-ass it. And then that patient, because you half-assed it, didn't get a good result because they didn't understand. It always comes...
Teaching the younger ones that came along, you specifically.
I videoed me teaching them, and then we put it on the platform. So now you can go on the platform and you can learn all this stuff. I can get people up to speed, 25 years of stuff up to speed in a weekend. It's unheard of. You hire that CA and she's making mistake after mistake after mistake at the front desk, or even an associate. A lot of the associates I've had, I remember one, he's like, I just don't know what to say. So he'd be in it with a patient and they'd get into something and then he would freeze because he didn't know what to say. And he's trying to reinvent the wheel. I'm like, no. Here's what you say. Here's what you do, and here's what you say. And then he learns it, and then he goes back the next day and he's got it. And it's solid and done. The analogies, the examples that I know work, because we've piloted those for years, those are the ones that we want to keep replicating, right? And wouldn't it be good for you to know that stuff, whether you've been in practice a minute or 50 years, it would be good for you to know that stuff, because then you just put more tools in your tool belts in patient understanding and communication, because that's where it is. The other thing people do is they like to always listen. My son's a chiropractor and he's new, but he likes to listen to all of his schoolmates. I'm like, bro, tell me about his practice. Well, you know, you don't take advice from people that aren't crushing it. Find the person crushing it. That's who you want advice from. That's called Business 101. It's not Chiropractic 101. We want to talk to the guy that has some other weird philosophy thing about it. That's what we want to all jump in with. And you can do that. Good luck with it. That will not grow your practice. Sorry. It just won't. The reality of it, and if you've been around, you know what I'm saying is true. So the market, look at where you are. When we talk about the marketplace, when we do seminars and stuff, I always talk about the things that we've done. I have won the Better Business Bureau's Trust Award for Ethics in West Michigan. How many chiropractors have won that? One, me. Wonder how many have applied. One, me, right? Why would I do that? Because I don't care what you think. I care what the patients think. And you want to play in the well, I'm in the chiropractic sandbox. I have a DAC bar, don't you know? And then you say that to the patient and they're like, a DAC bar? Is that like a bar for daiquiris? Yeah, you want strawberry or vanilla? Like what are you thinking of? Like patients don't even know what all that crap means. And you think that that matters. I haven't seen anybody who goes and gets out of this extra training ever have that grow their practice. Unless you're just going to read x-rays in a basement somewhere. It just doesn't. You got to play in the realm of the patients, which is the marketplace. So, Best of Grand Rapids, we've won that for 20 years. Why do I even mess with that? Because that's in the marketplace where the patients are, right? Small Business of the Year for the Grand Rapids Chamber. Why did I win that? Well, I won it because I put effort in, but I won it because I want to create credibility. I want to create trust and belief in the marketplace so that when I go and talk to people, not so much you, but patients, because they're the ones who need the help and are paying the bills, those are the ones we're trying to reach. So you want to do things that are in that marketplace. Not the chiropractic world. People always do that. It's so weird. I don't know why chiros do that. I guess medics do it too, but they don't need to get new patients. They have them coming out their ears. They can even do a terrible job and be rude and mean and still be busy. Whereas you say one thing wrong, like half the things I've already said today, the patient quits because they're mad at you. We have a very hard gig. It's hard. We don't have it easy like they do, where they just have people lined up, right, all day long. You actually have to hustle. You have to be a good communicator. You have to be able to show them the value of why they should be doing what you are recommending, why it even matters. You have to get really, really good at that. Or don't, and there's a consequence. There's always a consequence, whether you're a patient making choices, just looking down. I have so many patients that they'll come in and go, I don't understand why I have all these problems. And then I go, well, let's look at all the decisions you've been making up to this point with your health and wellness in your body. And then you look at them and then you go, where else did you think you were going to end up? Because they made a whole bunch of bad choices. And then they go, I didn't know I was even making choices. Whoa, that's heavy. But that's most of your people. Put them on some antidepressants so they don't care and know what's going on, and it's even worse. Now they're really just stumbling through life. Whoa, where am I? Who are you? What? How? Where? Like they don't even know what's going on. Because that's just what they do anyway. Probably from what I learned yesterday, it's probably too much amygdala. They're living in the amygdala and not the prefrontal cortex. Interesting stuff. So think about how big your market is, where your town is, how many people are there. Think about that. Think about how many chiropractors are in your town. And then you can do a little math. Because here's what chiropractors do. We all fight over that 8 to 14%. I've had chiropractors call me up mad saying, quit taking all the new patients. What? Get out of your frickin' basement and go talk to someone. It's not my fault that you suck. Like, go talk to people. Just go talk to people. Come up with a story. Go talk to people. You will get busy. The problem is we're all fighting over that gracious 14%. So my model is screw the 14% because they are the biggest pain in the ass patients you ever saw anyway. Because they've been somewhere already. And they think you're going to do it like they do it, or they did it. And how many of you do it the same as everybody else? I bet you nobody in here does it the same. So meeting those expectations are virtually impossible. Our biggest headaches are the people that have been somewhere before. So so if you're in business, forget about chiropractic. You're in business. Hey, here's a 14% market. Here's an 86% market. Which one do you think you should go after? I know you're chiropractors, you're thinking. It's you go in the big market, so you're better off going after the people that have never been before for a variety of reasons. One, that market is huge. It's huge. Two, you don't have to worry about whatever stuff we've all done to the patient in the past that they think you need to do. I mean, you've had those, right? They come in, hey doc, just, I don't need an exam. Just shut up and just crack my neck. We just had a guy do that. I'm like, oh my gosh, really? Here comes my 1-star review because, sorry, we need to do an evaluation. Evaluations are bullshit. I just had it on Facebook. It's so tempting. I want to just let go, but man, it lights the house on fire when you do. But the lady's like, evaluations are such BS. It's just trying to suck more money out of you. Yeah, because $40 is sending you to the Bahamas, right? It's like that's like the legal standard. So here I am, something happens, whether it's real or not, they sue me, I'm sitting in court, and the judge said, or the attorney says, so Dr. Mike, tell me what your evaluation showed on that patient. And then I go, I didn't do one. Goodbye. You didn't do standard of care. Goodbye. Now, if you want to do that, you can. But you're putting yourself at a ginormous risk for $40. Maybe if it was 40 million, because then you could just later say it was only 9. I didn't have 30 million. It was an accounting error. I only had 95,000. Right? Maybe you can get away with that because some people do. But here's the deal with that. You got to look at the big market. That's where you want to be. And then it's so much more fun when you have a person who doesn't know. So there's 2 main barriers to learning. Anybody know what one of them is? What?
You think you know it.
Yes, thinking you know. The other is misunderstood words. So think about chiropractic. Just that is a misunderstood word. Chiropractic, totally misunderstood. Nobody even knows what it means. And what they tell you will be everything from witchcraft to demon possession, all the way down to some medical guy who couldn't get into med school, so he became a chiropractor, and everything in between. That's the reality of what the public thinks about it. Sorry. I know, everybody just got all depressed. Hey, when you get them better, they love you and you become the man, right? You become the woman, you become the thing. When you get them better and you change their life, they are the shit. And that can be you. So just don't feel all beat up, but I got to get you to see the reality of the situation too. The reality of the situation is we have to be in that marketplace, and it's way better when you don't have confusion. So here's the thing, the confused mind always says no. Confused mind says no. Why do patients need to understand any of this? Because they don't do what you say. I realized a long time ago, my wife doesn't do what I say, my kids don't do what I say, the damn dog doesn't even do what I say. So you really think patients are doing what you say? They don't do what you say. They do what makes sense to them. Your job is to paint the picture, tell the stories so that they can understand it, and then once they know what's happening, then they're more likely to say yes. But when they're confused about it, they're going to say no every time. So patient understanding is critical to make sure that that's happening. Now you gotta not only go into the market, but you have to go into the marketplace, and then you have to do something called get known. Get known. I always ask people that I'm coaching and talking to, I always ask them, what are you doing to get known? And they go, what do you mean? I go, if nobody knows who you are and what you do, then nobody's coming in. It's a simple process. You must get known. You have to do, one of my marketing people that I know, way back when I started, she would always say to me, she'd say, Dr. Mike, you have to put yourself in play. What did that mean? It means I had to get my ass out of bed. I had to go and get into the marketplace, the chamber, the BNI, the networking events, the things where you can meet people, going to the different health fairs and all these different things. And people are like, oh, that's not professional going to those health fairs. Are you freaking kidding me? I got PTs taking pictures of my booth. The plastic surgeons were taking pictures of my booth. The plastic surgeons are there now. So whatever. Get out of your own way, man. You got to do. BJ Palmer's riding an elephant through town. You think that was professional? Come on. Like the master networker, the promoter, the man who did all of the amazing things to push the profession forward. I still think he'd be rolling over in his grave because we have no innovation. Everybody's like, you got to do it the way that Dee Dee did. Well, you do it the way Dee Dee did. BJ's running you over with the frickin' car. Because they fought and argued too. I just imagine that. But listen, you got to keep innovating. He innovated all the time. What did BJ come up with? What were his innovations? Man, didn't you guys go to school? Like, remember? Hole-in-one technique, right? Techniques. He came up with the neurocoulometer. Like he was like using X-rays so much so that I think it killed Mabel. Didn't he kill? Like, because they came up with X-rays. Like, oh, this is the coolest thing. We should just look at X-ray you 100 times a day. And then, whoops, that was bad. But he was innovating all the time, right? Constant innovation, which shouldn't we be doing that too? I think so. So think about what you can do to get known. What are you going to do? How are you going to get people to know who you are, what your clinic is? Those are all things that we talk about because that's where the difference happens, is in that marketplace. When people can meet you, and it's very interesting. We've done a lot of ads. I've done just about everything you can imagine to try to get new patients. The most effective way to get a new patient for my clinic is me talking to a person. Because then when they meet you, sometimes they don't think you're crazy. Sometimes they don't think you're weird. Usually when I meet them, they do think I'm weird. Why do you have long hair? That shirt hurts my eyes. Like they have things that they, like, so sometimes they still think you're weird. And that's okay. But when you can get face to face with a person, a lot of times if you can communicate with them the values of what we're doing, you can bridge these gaps. And when you can bridge those gaps, then you're getting yourself known. And then you're getting into the marketplace, and then you're going to have more things happening when it comes to bringing in new patients, and you're going to be able to do a better job with them because they trust you, because they know you, and they feel that way. What are some of the things you guys are doing to get into the marketplace? Anybody want to share anything? Awesome. Is that you post that? So social media, right? Social media, that gets you into the marketplace. How many of you are doing something on social media? It's not the horse tied to the ring dinger. I know. Oh boy. Those get a lot of views, but not a lot of patient driven in. Something like that's going to drive people in. They're going to see that. They're going to know. And then what do they used to say back in the marketing days when I was in marketing school? They said you had to touch a person 7 times before they actually would do something. The last marketing class that I went to, which in fairness was about 8 years ago, they said it was up to 11. That now you got to touch somebody 11 times before they come in. So it's getting harder because there's just more information. So you have to be everywhere. And you've probably seen that where when you're doing things, so like I had a lady come in, I go, what brought you in? She goes, I saw your pen. Because we have those old chiropractic crooked pens. I love those because everybody stops and looks. And then they go, but when they say crooked, I don't like that because that has a negative. I go, it's not crooked, it's ergonomic. Fits right in your hand. And then they go, oh, because they want to say crooked, but crooked then rubs off on you as crooked. So no crooked pen, you can't say that, right? But it catches attention. She goes, I saw your pen. Did she really see the pen, or was it 6 other things and that was just the last straw, and then she finally decided it's time to do something? So you want to be out in the marketplace on many, many levels, because each one of those things is making a touch and a contact with the people. And the more you can make the touch and the contact with the people over time, the more likely they are to then want to come in and see you as a patient. Social media is great. It's hard. It's very time consuming. What other things? Anybody have anything else that they're doing? Because one of the ways I get my greatest ideas is from you. Like, all my great ideas, someone else came up from, and I'm not going to recreate the wheel. I'll just take that thing and run with it. I'm like, ooh, that was a good idea. I didn't like the 10 other ones, but that was smoking hot. Give me that. And we're running for the touchdown right now with this thing. And people are like, wow, how'd you come up with that? Conversation anywhere, anytime, any place. Church, grocery store. One of the things we do, I tell our staff all the time, wear your stuff. Wear your shirt. Lori, you got your shirt on? Can you stand up? So she has her shirt. It says I Chiro on it. So this is what happens. You're at the grocery store, dome, 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 and then someone sees it, and then they'll go, what is that? I was just golfing. Every time I golf on a league, and I'm not good, but I'm there to meet people and smoke cigars. But anyway, I'm there, and I wear my stuff. I got my I Chiro hat and my shirt, and then they go, oh, what do you do? I Chiro. We actually had a guy looking for churros. He called the office. Do you guys make churros? Yes, we do. Right after you get your subluxations removed. How many churros do you want? We'll have them after you get your adjustment. No, he did. I what the hell, people. Anyway, you want to have something that creates a conversation starter. If you aren't using your own clinic, like whatever swag you can get, number one, get swag. And then anywhere you go, wear the swag. I know it's not as cool as wearing the other stuff, right? But it ain't about that. It's about the kid who's suffering, that needs your help, and if you don't do something about it, so it doesn't matter if you look cool with cooler swag, you need your clinic swag, because somebody's life is in the balance and it's hanging there, and you're either doing something about it or you're not. And you need to know you're doing something about it. And it always comes back to that. What were you doing? Yeah.
I host seminars at local high schools.
Nice.
I educate the students, the athletic students, about chiropractic performance. So I measure their baseline with like power and speed, and then I see where the dysfunction is at, maybe with their ankle or their knee, and then how chiropractic can.
Beautiful thing. Did you hear that? She's going into the high schools, educating the students, and then actually doing some screenings with them on their abilities, and then helping them be better. That's cool, right? You get some of them wearing your swag, telling your story, right, to their friends and people they know. And the better they understand it, the better the outcome. So here's what happens a lot. I just had this happen with this lady. She's impossible. Been to all these chiropractors. So she's like, shut the hell up, I'm just cracked my back. And we're pushing her through the process. She's not going to be a good fit. So she goes, she's kind of starts getting some understanding, but then she goes home. What happens at home? So wife goes home. Husband says, what did they say? Now here's where the rubber meets the road. If she says, duh, then it's a no. But if she can replicate what you taught her, then you're going to have some change. If they can't replicate what you taught, it doesn't matter. Then you didn't get the product. So the product, and we talk about this with our team all the time, because they'll say, I told the patient that. And I go, that's not the product. You telling is not the product. What's the product? them understanding in a way that they can retell it, reproduce it, and believe it. That's the product. So just because you said it, that doesn't mean they're even, I mean, you could say it and they're not even in the room. Doesn't matter. They have to get it. That is the product. And we get a lot of what we call product confusion. A lot of product confusion where people think that just saying stuff is the product, and it's not. And you get that too with even going to events and doing things. It's like, what is the true product? And sometimes you have to move the understanding of what that product is for patients who do not understand what it is that you're actually doing. Because they don't. They just simply don't, sadly. We're trying, we're all trying to get known, get out there, become a voice in your community. If you can get in front of any groups to talk, that is a phenomenal way, because then you don't have to do it onesies. You can do it with however big the group is. My first fibromyalgia seminar, so back then, I bought a slide presentation in the old carousels. Remember those? Click, 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 click. Sorry, I'm old. And they said, this is going to be the greatest thing. It's like crushing it. And I'm like, perfect. I have been training to be a professional doctor. I have watched Star Trek and I see how Spock acts. And that's how a doctor should act, and that's how we were taught in school. So I get up in front of this group, and there's like 50 women there. And I'm clinking through my slides. And I'm up there, today we're going to be talking about fibromyalgia. Let me read all the slides to you. And at the end, who here would like to come in for an evaluation? And it was a 0. And I'm like pissed. I just spent like, it was like $300 or something for this. And anyway, I'm like, that was so awful. And I was like so freaking professional. So I call the company and they're like, send me a video of you doing the next seminar. Oh yeah, not a problem. I got a big, huge VHS camera. So we're videotaping me and I do it. And I send it in, and I'm all proud, man. Because, man, when you're young and cocky, man, you're just proud. I'm all proud about this thing. But again, I got nobody. So then the consultant calls me back. He goes, I just got your video. And I go, oh, yeah. Pretty awesome, right? And he goes, that was the most boring thing I've ever seen on this planet. He goes, I couldn't even make it 3 minutes in. It was so bad. I'm like crying. I'm like legit crying. I'm like, oh, what? Like, what? And he goes, that was so dry and boring. Like, who in their right mind would want to watch that? And I'm like, crushed. And he goes, you've got 2 choices. You can either say, that's just how I am. That's how God made me, and I'm going to be boring. He goes, or you can change and decide that you're going to have to learn some skills on how to be more entertaining when you do a seminar. You're going to have to learn how to tell jokes. You're going to have to be funny. You're going to have to be a smartass. You're going to have to start doing something. You might have to swear here and there just to keep you guys awake and have your attention because everybody falls asleep, right? Because you're going to have to learn some of this stuff. And begrudgingly, I did. The next one that I did, I'm like, screw Spock. I'm not being Spock. Throw the white coat into the dumpster, and I'm just going to go up there and be my smart-ass self. And I went up there and I told jokes and I joked around, but we went through the information and we did it. And at the end of that, I told my mother-in-law, I go, because she came just for support, and I go, when I say it, does anybody want to come in? Run up there so that everybody sees, at least one person's gonna. And she's like, okay. So then I'm like, all right, we're wrapping this up. If anybody wants to, come up, we'll get you set up with an evaluation. Come on up over here. The girls are over here. They'll help you. And my mother-in-law runs up, and literally like 40 people followed her, and they all in this giant line. And it was the same presentation, same slideshow. It was the same person. I just acted different. And that really hurt my feelings, kind of. But at the same time, I didn't care, because how many of those women's lives did we change? We had a lot of really amazing successes with that stuff. And you guys do too. But if you don't put yourself in play by doing that seminar, because you're too scared, I don't want to talk or whatever, or if you're not willing to change and become better at doing whatever it is, right? Then you're going to struggle and those people aren't getting help. And then you got to go back to the scales. It's not 6, 7. This is scales. You guys are all old. My kids would have died laughing on that. The scales. What's more important? You changing and becoming better at presenting and more funny and more jokes and whatever, being more relatable, or that person suffering? When you always put that other person's suffering on the scales to your discomfort should always lose. Because that's just silliness. That's just you being a baby. You just got to get better. It's okay. And shouldn't we all just live our lives that I want to be better than I was yesterday? That's what I try to do, often unsuccessfully, but I try to be better than I was yesterday. Let's do a better job than we did yesterday. Let's just constantly improve. And when does that improvement end? Yeah, when you're dead, right? And that never ends, because that's what a player does. A player is always trying to get better. It's not like even Tiger Woods. He didn't go, oh, I'm at the top of the game, I'm just going to do nothing now. I mean, he gets in car accidents and does crap. But when he was before all that, these elite athletes, they're always trying to get better. They always have coaches. They always have somebody helping them, because it's hard to see your own blind spots. They're videoing me today. I'm going to scrutinize that video and go, what could I have done better? What did I say that I really shouldn't have? Because somebody gets offended, right? There's a lot of things. So you always want to be looking at that. These are some of the things that are in the market for my office that we use to differentiate ourselves from all of our competition. So when people want to talk about me versus any other clinic, whether it's the chiropractor across the street or the PT or the medical guy or whoever, I always have to make and try to make myself look better than them. That's called marketing. That's called marketing, and you should do that too. And you need to get things that are out of the marketplace to help you boost on these things. Credentials here don't do it. Nobody knows. I'm a certified strength and conditioning specialist, so CSCS. How many patients do you think even know what that means? It's a small number, and they don't even care. They don't even know. They don't care. People don't come in, oh, I see you're a CSCS. I need to come into your office. That never happens. Never once. Now, do I get some nerds who are in the workout industry, and then they see that, and then they might give you a little bit more, like, listen, credit? Yeah, that happens. But it's not the magic. The magic is just you being in the game and having the conversations. If you can get a bunch of stuff like this, I would encourage you to do that, because then you got something to talk about. So then on your social media, then you can say, hey, look, we won this. Take a picture, put it on social media. Next week, you do another one. Oh, look at this. I just made a reel with all of these where I just went through and talked about it. Hey, look, we've won all these things, and there's a reason why. Do we get good results? We do get good results, but so do all of you. Really what it comes down to is just, are you a good marketer or not? And are you in the space? Are you out in the space where the people are, or are you stuck behind your computer trying to debate whether or not subluxations exist and what happens, you know, when a cat is subluxated, and how do I adjust that? And that's what you're doing. Listen, that does not drive the practice unless you're going to just start seeing cats, which I guess some people do that. But if you want to see patients, you need to stop that nonsense and put yourself into the market where all of the patients are. And that's where you want to spend all your time. That's where you want to talk. And none of that stuff matters, because it doesn't even matter if you understand it or not, because you still get results. They didn't know how adjustments worked, and they still got great results. When I was a kid, I had no freaking idea. All I knew is I cried every time I got adjusted, because the hammer fell. Back then, there was no light force. Old Uncle George would make me cry, because it hurt. I was in a car accident. We hit a drunk driver in a truck. A lady hit us going 55 miles an hour head on. She swerved right into our lane and smashed right into us. Back then, we didn't wear seat belts. I was in the back seat, and I hit my head on the one window, flew all the way across that cutlass to the other, hit my head on that window, and then we went to the hospital. And what do you think the hospital said? He's fine. There's nothing wrong. He's fine. Because what they meant was, I'm not bleeding to death. I don't have a broken bone. I'm not an ER candidate. What they should have told my mom was, he's fine from an ER standpoint, but there ain't no way in hell anybody survives that and doesn't get their neck jacked. You should probably take him to the chiropractor. And then I would have never had all that crap happen, but I probably wouldn't have become a chiropractor either. So
did the headaches happen after that or before that?
after that. So after that car accident, then time went on, and then all the problems started brewing. But nobody equated that until I went to George, and George is like, well, have you had any traumas or accidents? And we're like, no. And then all of a sudden it's like, oh wait, we did have a 55 mile an hour head on with no seatbelts. Might that have done something? Maybe, right? And I tell you, it jacked my neck permanently. Like it was not a good thing. But we didn't know. We didn't know. We just went with what they told us. And that's where your patients are. They don't know either. They're all in the struggle bus with you. So think about the things that you can do in your market to differentiate yourself from the competition. If you need help with that, I'm happy to help, because I love talking this stuff. It's exciting to me, because then I know one day I'm going to be dead, and I'm going to be in heaven, and there's going to be a line of people high-fiving you on your way in, because you helped them. And I don't know about you, but I want that line to be long, because you're not here to just be like a pebble dropping in a little pond and like, oh, I made a little ripple in this life. You are not here for that, because you're a chiropractor. You are here to be a nuclear bomb going off in that pond, and impact, boom, all over your sphere of influence. You need to make an impact, because that's what you owe to the world, because you've been graced with this knowledge. People don't know it, but you do. Damn, that's big responsibility. So now you got to do something about it. You got to be a bigger voice. You got to be a bigger impact. You got to be a bigger clinic. You got to help more people, because that's what you do. And I believe that each one of you are born for that reason. I think each of us got created for that. I think you're here for a reason. I don't think you're just here to get your credit. You've been positioned here in this class to learn some of these things, because one of these things that I go over is going to push your button, and then you're going to go, and you are going to change someone's life. And I'm going to feel good about that, because I had a hand in it. But you really had the hand in it, probably 2 hands. So think about the things you can do. We're going to take a break here. When we come back, I'm going to talk about subluxation, how it works, show you how to communicate this to people so that they can understand it, that they can tell other people. You can have the science behind it. And that way, you're going to be able to help more people as they understand better. Thank you guys for your time and attention. I'll see you back here in a few minutes. Little commercial I'll give here in a minute, but one of the things with patient understanding is, I mentioned already, the confused mind says no. If you can make that your mantra, that will help you tremendously. If you're confused, you're saying no. Think about yourself and anything that you do. If it doesn't make sense to you, you're out, right? And this is where we got to make sure we're really driving these points home. How do you know that it's true understanding? They can reproduce it. So we have a thing in our office. It's called ask versus tell. So we do a lot of telling. And half the time people aren't even in the room with you mentally. I even have it where you'll ask a question and they'll look at you and then they'll go, oh, were you talking to me? And I'm like, where were you? You were just missing in action somewhere off in the stratosphere. Not present time conscious, right? So trying to bring people back into present time consciousness when you're talking to them. That way you can make sure that they're getting the product. So if you ask versus tell, I would write that one down too. That's a great little thing to remind you. Our staff, our doctors will tell you, we beat on that all the time because they'll say, I told them. And then we're like, that's not the product. Ask them to explain it to you. And then you'll find out what truly is being understood. And when you can do that well, then that's going to be a referral machine. When people can explain it to somebody else, that's when you get lots of referrals because they can actually reproduce it. They also won't screw you up so much when they go to the doctor. So they go to the doctor and then they ruin it for you because what do they say when they go to the doctor and they talk about what you're doing? Crazy shit. That's what they say. I had a lady, so this old guy's coming in. He's like this, right? Well, we get him 6 months of, we get him this. So he goes in for his physical. And the nurse says, well, we must have measured something wrong last time because you're 6 inches taller than you were before. And he goes, no, I go to the chiropractor and they're making me taller. And the nurse is like, oh, those quacks. And I'm like, dude, why did you say that? That all you had to say was you were a hunchback old man and now we got you upright. So now you're taller. You really, so now our credibility with them is in the toilet and they just think we're weird because we were doing some strange thing. They like to do that. Patients, when they don't understand, they like to explain it with weird stuff. So I hate that because it never helps. Not in those science professions, the PTs, the other chiros, even massage therapists, but all the medical people really have a big misunderstanding on what we do and how it works. I have taken some of the technology we use to over 100 medical clinics just in my town. I had to have a girl, all she did was bang the phone. She had to call 50 medical clinics to get one to be willing to see me. 50 to get one. And then I'd go there and they give you 10 seconds and really weren't interested in what you had to say because it's not what they do, even though you could help people. So then it's really weird. I'm like, do you care about helping people or is it's just your it's just a paycheck for you? You're just cranking the crank. It's kind of disturbing. But 3 of your big drivers, these are your 3 drivers. In the business realm, what drives your business? Well, 1, new patients. 2, getting the patients you got to do more stuff. 3, getting the patients you've got to stick around longer. Those are the drivers. If what you're doing does not lead to one of those, then you're screwing around. Those are the targets. When my staff talks to me, oh, I'm going to do that. Should I do this or should I do that? Which one's going to hit one of these drivers? Should I sweep the floor and go back and rearrange the files? Or should I call the people who haven't been in? Let me think about that. Obviously, you do the things that are going to drive these. But you have to even know what these are. So what I find is a lot of guys don't even know that these are the things that are driving your clinic. You have to put these targets up, and then you got to think about it all the time so that every time you're doing something, you're asking yourself, is what I'm doing right now going to make one of these happen? And if the answer is no, then you need to readjust what you're doing. Because if you're not doing this, you're not helping people, and you're not going to be making enough to even survive. And you don't want either one of those. You got to have these things drive. Anybody have any questions on these? Because they're the big ones. When we talk about this stuff and understanding, and I talk about even the learning platform that we have, which is, you can join this, you can buy access to our learning platform so that you can get in there and actually learn these things, and then have it for your staff too, so you can have them trained by our platform. First, you have to understand, as the doctor, as the leader, you got to know how things work and what's happening. Second, your team, they need to understand it. And then third, your patients, they need to understand how it works. And then obviously any referral partners that you have, they need to understand how it works. Because those are fragile beasts. They're very fragile. I have a doctor who refers to us routinely, but he doesn't understand it at all. In fact, what he thinks is flat out wrong. But he will not allow me to talk to him about it. Why? What's the barrier to understanding? It's not a misunderstood word for him. What is it? He thinks he already knows, so he doesn't want to hear it. And you'll get this with patients. The patients who are coming in that have been somewhere else, they think they already know too. So you just need to shut the hell up. They already know. That's what they're thinking in their head. I tell my staff all the time, when you're dealing with a patient and you're talking, this is what you need to be hearing from them in your mind. So what? That's what you need to hear. Because that's what they're thinking. Every second they're thinking, so what? Who cares? What does that have to do with me? So what? If you're thinking every time you're talking to them, like right now I'm thinking, you're all sitting there going, so what? Yeah, so what? You better get your act together or else you're going to have problems. You're not going to be where you need to be. So we need to make sure we're thinking, so what, every time. Big problems are the time factor, and that's where our learning platform comes in. The learning platform, that's how you save time. When I have to sit there with a patient and explain the routine things that I explain to every patient, that takes time. So what do we have? It's a video. The patient watches it. Then I don't have to do it. Staff, how do you train them? I can have my whole staff trained in a weekend and I'm not even there because they go on the platform and they learn it. And then they're teed up and they are ready to rock. I can put, and I have done this, and I wish I would have brought Jackie with me. She's been with me for a long time, but she can explain chiropractic better than like most chiropractors. She's incredible. She's not even a chiropractor, but she understands it and she's a communicator. So she can build the value for patients and help them understand. It's really kind of exciting. Now this is where I get to try to hurt your feelings, but I'm going to bring this whiteboard up here. Because I'm old school. I'm like, do they have a whiteboard? And Lisa's like, we don't even use those anymore. I'm like, well, I'm old school. I need a whiteboard. So we're going to talk about a subluxation here and what that is and what people think it is and what happens. And my belief, based on over 10,000 patients and lots of time in the marketplace with the people, not with you chiropractors, but with the people. The people think things. And the things are not accurate, but it leads them to a consequence, and it leads you to a consequence as well. One of the biggest core pieces of misinformation, I believe, this is my opinion, I think is thinking that your back has popped out. People say that all the time. My back's out, my neck's out, this popped out, that popped out. Last night at the seminar I heard the lady say her ribs out. And it's like, you all know that means what? Out of alignment. People who are not chiropractors, including the medical doctors, they think when you say that, what do they think it means? They think it means dislocated, out of joint, okay? see if I can make this work. Name a part of the body that people throw out a joint. The back. Number one answer. Really? Who here has ever even seen a facet dislocation? Have you ever seen a facet dislocation? Those are emergency, at least when I took boards, one of the questions was, what do you do with a facet dislocation? Answer, 911, get them to the ER now, because that can be unstable. You can sever the spinal cord. Your vertebrae, there's a thing going through them called the cord. That ain't popping out a joint. You'd sever the cord. But we all talk this way, seeming like it's semantics. And the guys I argue with on Facebook, I think they're not in here right now, they always say it's semantics. But there's a consequence to it. There's a consequence to it. Just in case you were wondering.
Part of the body that people throw out a joint. The neck.
The neck is number two. It's the neck, right? That's what people think. Now you're sitting there going, and what are you thinking? Starts with an S. So what? That's what you're thinking right now. So what you're thinking, right? It matters because when people think that's what's happening, there becomes expectations of what you should do and how you should do it. So the first thing they're going to do is they're going to go on Google and they're going to say, does my back pop out of joint because my doctor says that's bull crap, but the chiropractor's like, your hip's out, your back's out, your neck's out, whoa, your ribs are out, everything's out. And then they read this, no, the spine does not pop out of joint. Now, what just happened to them? They became what? Starts with a C.
Quacks.
Confused, right? You're telling them one thing, other people tell them another, and Google's telling them something else that doesn't agree with what you just said. Uh-oh. So what do you think the patient does? They write you a 1-star review and say you're full of it. And you're witchcraft, bullcrap, or whatever it is, right? Because this is what it is. Now you go, well, that's just against chiropractic philosophy. No, it's not. What did DD call a misalignment of the spine? Subluxation. Sub, less, lux, ation, dislocation, less than a dislocation. They already knew that it wasn't popped out of place. DD knew it. What the hell? How did we not know it? And how did patients pick up on this idea that their back is popped out? Now you go, so what? Like, who cares? You know, it doesn't matter. Well, here's what patients think. How do I know? Because I run into them all the time. The people who are not coming in. These people, when I go to marketing events, I just talk to the guy and we have this conversation and I was telling him, your back doesn't pop out of joint. He's like, what do you mean? So if I show up in your office and I think that my back popped out, what should you do? Pop it back in, and how many visits should that take? 1, unless you suck or you're trying to scam me into more visits. That's what they're thinking. And that's why a lot of chiropractors will just do the, hi, nice to meet you, lay on the table, bang, bang, have a nice day, come back when you need me, because it's too damn complicated to try to break through all that bull crap. That's a lot of weeds to mow in the understanding realm. But it's not real. You're not treating facet dislocations. Trust me on that. If you're not sure, go back and study, because it's not how it works at all. But people think that. And they think it with ribs. I got in an argument with my buddy who speaks for foot levelers, because he always says, you know, when my rib's out. And I'm like, you gotta stop saying that, bro. He's like, what do you mean? I go, when you say ribs out, people think it's dislocated. I don't know about you guys, but I remember on national boards, it said a dislocated rib is a emergency room referral. Because if you push on it, it'll puncture the lung and you can kill somebody. So you're not treating dislocated ribs unless you're banding them up and stabilizing it and all of that, but not with adjustments, right? So what is it? It's less than a dislocation. Well, how could something be less than a dislocation? So let's see what we can do. So forgive my drawings. I know some's probably wrong, but just easy. Like, get the concept here. So here's the vertebrae, the deep stabilizer muscles. So this is, when I was in school, there was a PT who would always give us shit. And he'd be like, if you can explain a subluxation, I'll tattoo your name on my forehead. I'm like, all right, motherfucker, you better get that tattoo gun out because I am coming right now. Get ready. And you're going to be loving it. I'm going to want pictures. So here's the vertebrae. What's this? It's a muscle. Which muscle? Intertransverse. So intertransverse, what's this? Interspinous. Spinalis, right? What do you got? Rotator brevis, rotator longus, multifidus. These are the deep stabilizer muscles. These are determining your listings. Think about it. If this muscle gets hurt from something you do in life, why do I say in life? Because patients always want to blame a thing. You got to shift them off of that and get them onto it's just life that does these things. When one of these muscles get hurt from life, what will happen to this muscle? Will it contract and shorten? All the muscles will, right? Unless they're torn. So it's going to contract and shorten. What's it going to do to those two transverse processes? It's going to tip them. And then the whole thing shifts over that way. And then it's not going to move right because it's locked down. And probably not just this muscle got hurt, probably other ones in there did too. And if they're on this side, they'll pull it that way. Now you've got these deep muscles that are doing the contracting, and that is your spinal alignment right there, not popped out of joint. That's ER. Why do I want patients to understand this? Is because they need to understand that it's about muscle, but it's also about nervous system. So what is in these muscles? Starts with an M. Oh, some mechanoreceptors. Mechanoreceptors are in these muscles. And these mechanoreceptors are how the brain receives information about what is happening in the muscle. Okay? So let's see if we can look. Anybody remember what any of the mechanoreceptors are? Muscle spindle, Golgi tendon organ, the GTO. Now you have mechanoreceptors that are also in the skin. And you have joint receptors in the joints. So in the skin, the mechanoreceptors, you've got Merkel's disc. This is in the epidermis. Merkel's disc for gentle touch. Meissner's corpuscles for discriminatory touch, low frequency vibration. Below that in the dermis, Krauss's end bulbs. You've got Ruffini corpuscles, Pacinian corpuscles. These are all receptors in your skin, and then we have the ones that are in the deep muscle. They are all picking up data. If you're wondering, how does chiropractic affect the nerves? The old idea that the vertebrae were pinching on the nerve root, we know that's not how it works. That can happen with severe arthritis, but it's not the foot on the hose that I was taught in school. I'm called Palmer and wanted a refund. They said no. So we know that these receptors, mechanoreceptors, are like think of it like the end of the nerves gathering all the data. Then they flood all the information back. And that information then is how your brain tries to decide what to do. If you've been to Heidi Havoc's or next door, the lady that works with her, they do a lot of brain prefrontal cortex explaining how things work. How does the information get there? Through these mechanoreceptors. Mechanoreceptors then send the signals. So this is your spinal cord. So you've got the muscle over here. When you stimulate that muscle with a quick stretch, whether you're manually adjusting or even using an instrument, the quick stretch causes what to happen in the muscle spindle? Stretch reflex. So the muscle reflexly lets go. So in these muscles, if this is contracted and shortened, and then we do an adjustment to it, that muscle will reflexly let go. And then that opens back up. In the nerve, that muscle, when you do that, it's going to shoot messages through the 1A afferent that is going to shoot around, go into the spinal cord, immediately shoot back, go back to that spindle and reset it. Reset on the spindle. It also then through the 1A afferent, that when it goes through down through there, it's then going to go through the alpha motor neuron. It's going to shoot a message to that muscle saying, let go and relax, even if it's been tight for decades. You're reflexly causing these muscles to let go and relax. That's why when you get adjusted, you go, ah, whew, all let go. Problem is, if it's been like that for a minute, you're not going to change a muscle in a visit. So what's the muscle going to do? Tighten back up, and then you got to do it again. What a lot of people miss is you also, in the tendon, the GTO, when that gets fired, that'll reset that GTO too. The tendon will relax and let go. So you get both of those letting go, but then you get the message going back. Where does this go? That goes to the brain. Now here's how I explain it to patients. Think of it like in GPS in your car. So when I'm driving my car around and I plugged in a destination and I go down a route, what does my GPS say? Recalculating. And then I go this way. Recalculating. Recalculating. Your brain is nonstop recalculating your movement patterns and everything that's happening in your body based on all the data that's flooding in. The more mechanoreceptor firing we can get to go up to the brain, the more change. I just learned yesterday in the seminar next door, how many stimulations does the brain need to change? Was anybody in there? 6,000 to 10,000 before the brain changes, recalculating the movement pattern, right? So you're flooding the brain. So if we can get all of those skin receptors to fire, all those messages to fire, go up to the brain, it'll recalculate. When the brain is recalculating the movement patterns, then it's going to run the body differently. So what happens is when you have an injury, so say I get hurt, the tissues that are hurt, my brain will then take the fibers of those tissues and say, you don't get to play in this game no more. You're going to sit on the bench. You're benched. I'm recalculating a new movement pattern called a compensation pattern on how you're going to move from now on. And now that's the new you. And you didn't even think it consciously, it just happened. Okay? Then the next time you do something that you get hurt, what does the brain do? That again. But now you got compensation pattern upon compensation pattern upon compensation pattern, and they just keep happening. And then what happens to your function and mobility? And then you say, oh, I'm just getting old. Well, really your list of compensation patterns from your brain recalculating how you move, that's just gotten a little bit out of control. So, when those movement patterns are not good, they're going to cause other consequences. Think about the things you can do. So what could you do to the skin that would stimulate and fire these receptors? So remember, all these receptors. Now, I got receptors in tissue that's on the bench, not in the movement pattern anymore. If I take some type of instrument or tool that's going to stimulate those receptors, or even I manually get in there because those receptors, what are they doing? Low frequency vibration. Sensory low threshold, stretch, pressure, deep rapid pressure, vibration. So if I get in there and on a muscle, is that going to fire those receptors? Answer, yes. It's going to fire some of those. The more recruiting I can do to fire receptors, what do you think happens to the brain when it receives that data? So your brain's sitting there going, hey, what the hell are you doing? I told you you're on the bench. Now you're trying to get back in the game. And you do it enough, the brain, after 6,000 to 10,000 of that, will go, well, son of a gun, I guess you're back in the game. And it'll pull the tissue back in the game, and then it will recalculate a movement pattern that's a compensation pattern again, but it includes that, which is a better movement pattern. Question?
So I kind of think, like I try to make it make sense in my brain, how long that would actually take. So 6,000 to 10,000 stimulations, the brain is firing so fast, that may actually only take a few minutes.
It could. Depends on what's being fired, right?
Yeah.
The bottom line is you've got to retrain the pattern no matter how long it takes. And there's a way to know when the pattern's better. And we're going to talk about that. Think of it like this. If I took my arm, so when we're talking about muscle and tissue, what I'm trying to get you to see is if you can shift your patients out of a bone popped out of place model and onto a muscular model, you're going to have better outcomes. One, because they've already bought into the model of muscle. How do I know? Who's not a chiropractor in here? All right. We should go to the gym and work out. Change muscles. How frequently should we go?
3 times a week.
3 times a week. What the hell? And you're all afraid to go and recommend 3 times a week, right? My daughter had like this, her eye was a little lazy, so we went to this like vision therapy place, and they're like, well, we have to repattern her movement pattern of her eye muscles and how her brain is telling her eyes what to do and all of that. And we need her to come in here and we're going to do all these exercises and therapies with her. Sweet, let's go. Guess how often? 3 times a week. So I went with my trauma as a child. One of my patterns that I developed as a coping mechanism for stress was grinding my teeth. So we have a dentist in Grand Rapids. He hooks all these electrodes up to your face, neck, everything, traps, and then he puts you in these different jaw positions until there's very little muscular activity. He then builds a mouthpiece that you wear that holds your jaw in that position. He fixed me from clenching my teeth with this thing. But guess how often I had to wear it? Twice. It popped out. I just wore it twice. It popped back in. We're good. No, it's all the time. I had to wear it all the time, 24/7 for like 3 months. Then the pattern was reestablished. And now I don't clench my jaw anymore, which is saving my TMJ joint, which is worn out to hell. So think about these muscles and tissues. Patients are already bought into the idea of that. When I can get them to see it's not popping out of place, it's your muscles and tissues, we have to change the way. 2 things we have to do. 1, you got to change the pattern. 2, you got to make it stronger. Those are the 2 things we're doing. They think it's just strengthening, then what do they think the solution is? If they think it's just strengthening, what's the solution for them? Just get an exercise. Yeah, PT, or I just need to go to the gym and work out. Could I go to the gym with a restricted range of motion and a bad movement pattern and work it out? I could do it, but will it fix the problem? Give you an example. I have an attorney friend, and he just had a case. Girl had hurt her shoulder and didn't want to do PT, didn't want to go to chiro, none of that. That's all bull crap to her. So she's not doing any of it. She's just going to go to the gym because that's science. And so she's in the gym. And this is a case, so that's how I know the details. So she's going to the gym 4 days a week for 3 years, working out like a mad woman. She's like all ripped and fit, right? But why did she go? For her shoulder. So then she's in the gym with her medicine ball, holding it, and one of the trainers comes up and goes, bang, and he hits the ball. And she drops it, and then tears her rotator cuff, supraspinatus, and she tears her biceps tendon. Which arm did it tear? The one she had hurt previously, or the one that hadn't been hurt? The one she hurt previously. Why? She's so strong now. She's been working out like a mad woman. Why would that get hurt? Well, we know in the rotator cuff, but all muscles and tissues, they fire in a certain pattern. The rotator cuff fires in a firing pattern, a stabilization pattern. 4 muscles, right? They fire in a pattern to stabilize the shoulder. Well, when one gets hurt, what does the brain do? It puts parts of that muscle, fibers, on the bench. And then it makes a new compensation pattern around it. So think of it like that. Muscle gets taken out. Now these 3 are doing the majority of the stabilization. And it varies. So if you're sitting there trying to argue with me, it varies depending on the injury. It could be severe and torn and ripped off, and then there's now it's not doing anything. Or it could be just minor, few tiny fibers. You don't know. Bottom line is you know that there's a compensation pattern that has been developed around that. So now when she goes to the gym and she works out and she's doing all the stuff, right? She's doing all the things. What is she reinforcing? Compensation pattern. And that has consequences. So you think she has more arthritis in that joint? Yep. She does. So how would she have known that there was a compensation pattern? Because she thought she was doing great. She thought everything was fine. She still had symptoms though, but was stubborn, wouldn't do anything. Muscles take time to change. People understand muscle change already because everybody knows if you're going to go to the gym, you need to go frequently. Why? To change muscle. So 2 things, repatterning. We got to repattern the movement pattern at the same time, and that's where frequency of treating people comes in. Bang, 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 do, 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 all the things you're doing, right? You're changing the pattern, changing the pattern. The other thing you're doing is then you want to like strengthen it and make it stronger. People understand that, they already buy in. The idea that you popped out of joint, you're going to get 1 visit. Maybe 2 if you suck, and they'll give you another try because maybe you had a bad day. I just had a guy come in. He comes in, I've been to 6 chiropractors. None of them can pop my neck back in. Big, huge guy. And I'm like, well, how many tries did you give him? Well, I gave him 1 each. He's dead serious. This is who you're dealing with in your public. This is not us. This is the public. Remember, they don't have a freaking clue. They're clueless. Not out of them being stupid. They're probably smarter than all of us. They just aren't educated in this and they don't know. And we've been letting everybody get away with your backs popped out. Nobody gets away with that. If you say that in my office, that's a red flag. Anybody hears that? Red flag goes up. Statement of misunderstanding is what we call it. Somebody just made a statement. You better go fix that now because then they're thinking they came in, you popped out, you pop it back in. I'm golden. I'll be back the next time it's out. Peace out. And then they don't get results. Because it comes right back. Why does it come right back? For chronic problems. Now acute problems, yeah, I know. I've had them too. The one adjustment miracle and it's like, ah, right? I actually had a kid talk. He never talked. Bam! Sent that atlas all the way across the room. Sounded like a gun. He goes home. Kid didn't talk, had all kinds of problems. Mom's like, whatever. Kid goes home. Dad calls me at night. Cell phone, flip phone. Hello? What'd you do to my son? I'm like, oh shit. I go, what do you mean? He goes, he said dad for the first time tonight. You see stuff, right? But that don't happen. How many times that happened in my 27 years? Once. You're not building a practice on that, sorry. Although this whole family, I all pile in now because they're like, holy shit, that's something to it. They're all coming, right? You do see those things, especially acute cases. Acute cases, why would an acute case not pull back? Because it's an acute case. You don't have all the scar tissue and crap yet. Think of it like this. If I take my arm and I tape it shut with duct tape, and I walk around for 10 years, and then we pull the tape off, and then I see you, and you go, hey, Dr. Mike, your arm doesn't work. And I go, hey, it's fine, it doesn't hurt. I don't need you. Like when you go to the events and people are like, oh, you're a chiropractor? And they go, oh, whoa, whoa, my back's fine. My bones are good. That's my favorite one. Oh, my bones are good. I'm like, dude, I'm not going to grab, ha, ha, cha, 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 cha. Hey, nice to meet you at this restaurant. Ha, gotcha. Ha, ha, ha. Like, what the hell are they thinking? It's cuckoo. It drives me nuts. But they think it's your bones. So taped up arm, walk around 10 years. You say, hey, that don't work. I say, I'm fine, it don't hurt. We peel the tape off, will my arm open? Hell no. Can I just say, hey, you look like a strong guy. Give her a big hard pull and we'll pop this baby right back in joint. Just pull it hard as you, like, could he just pull on that once and it'd be fine? As soon as he pull on it, am I gonna like it? Probably not. As soon as he lets go, what does my arm do? It's called creep, muscle creep. Not the guy at the bar last night. That's a creep too. We're talking about the muscle. The muscle will try to pull back to how it was because it's been that way for a long time. So how would I get my arm to straighten out? If I just pulled on it once and let go and then the creeped back, would I then go, oh, I tried that and it didn't work. Gave you one shot. Tried that chiropractor, didn't work. No, you would need multiple times, right? You'd have to work it and work it. And how much would be too much? How much would, if I worked this, how much would be like, oh, you got to settle it down there, buddy. That's too much. What would be too much? Nothing. The more you do it, the faster you would get the change. And if we did it long enough, frequently enough, what if I only did this once a week? If I just pulled it once a week and then it pulled back, would I get anywhere? Probably not very well. What if I did 3 times a week or more? Would it change faster? Yes, it would. What if I did every day? If you want to see a cool video, Google on YouTube, Heidi Havoc, visit frequency chiropractic. She has all the data. Here's the data on chiropractic frequency. Once a month, twice a month's better than once a month. Once a week's better than that. 2 times a week is better than once a week. 3 times a week is better than twice a week. 4 times a week is better. 5 times a week is better. 6 times a week. It's the more you do it, the better. Why? Think of the taped up arm. The more you worked it, the better it's going to go. What's the other piece? The neurologic aspect. The more we do that, the more the brain adapts and says, it's okay that I move that far. It's okay. I'm neuro-adapting. Now I can move that way. It's okay. And I can then have that range of motion come back. People understand the muscle part. This is where you can really get huge change, because what happens is they want to quit before it's fixed because it feels better prior, because you can feel better. I mean, here's the deal. I can take a hammer, smash my little toe, and you can crack my neck, and when that endorphin release hits, my toes feels better. Did you just fix my broken toe? Or was it an endorphin release and damn, everything felt better? I know, that hurts everybody's feelings. It's just true, right? It's just true. And then when that wears off, you go, well, son of a bitch, I knew that wasn't going to fix my foot. It came back. No, the endorphins just worked out of your body, and now they're not in your bloodstream anymore. So now it hurts again. Weird. Think about the muscle. that's what's shifting, torquing when you're doing treatments, however you do them, that's going to actually then get those muscles to change. When you do it frequently enough to change the pattern and then to put it in a state that it can be stabilized, the person's going to have much better outcomes. Much better outcomes. Now, why do people all want to quit? Why do they want to quit when they're like doing stuff and they feel a little bit better? Told you I was old school. Some of you you already know this. So, what controls everything in your body? This is your participation part. Yes, brain. Brain. How does the brain do that? Through what? All your nerves. When that works good, how do you work or function? It's called good. We call it a state of ease. Everything works well. What happens when you do stuff in life that hurts those muscles? They tighten, the messages get mixed up, you start getting movement patterns that are recalculating, and now you don't move right, you got a compensation pattern, you start to have problems. What happens when that occurs to your function? It starts to malfunction. But you feel great, then it goes in a state of dis-ease, but you feel great, and then when it gets bad enough, say below about a 40% function, what do you start to notice? Symptoms. Now, what am I trying to show you here? I'm trying to show you that things got to get bad enough before you feel it. So now we want to piggyback on what people already understand. So do you go get a mammogram, pap smear, blood pressure, colonoscopy, cholesterol check, general blood evaluation, go to the dentist, have them look at your teeth only when you have a symptom? If you did that, if you went in, the doctor said, hey, look, time for a prostate exam, colonoscopy, and he says, oh, but wait, how do you feel? And you go, hey, I'm feeling good, doc. Does he go, we'll wait till you feel it. Have a nice day. You could, that would be malpractice, right? So when you go to the dentist, does he just go, all right, which tooth hurts? And you go, well, none. He doesn't go, well, what the hell are you doing here? Get the hell out. Come back when you got a toothache, man. Freaking idiots. Is that what he says? No. Why are we doing that? That's what everything has to be symptom driven, right? And that's just stupid. By the time people feel it, it's already a disaster and wreck, right? So we know things have to get bad before you even notice symptoms. In everything from your teeth to everything in medically that's done. It's in chiropractic too, the musculoskeletal realm. So how do you end up there? Well, here's how you end up there. Hopefully you're born 100%, everything's great. But then you get on this planet, it has gravity, and you do stuff. You slip, you fall, you shovel, you sleep wrong, you play sports, you crash cars, you do things, and every time something happens, you have these little minor traumas that your body is adapting to. You have all that happening, but they start to build up like straw on a camel's back. This is another key messaging point for patients. Straw on a camel's back. Look, a pen. Oh man, I hurt my back. How'd you do that? Well, I picked up this pen. Well, does it weigh 100 pounds? No, because it wasn't the activity, it was my inability that I didn't know I even had. But everybody wants to blame the activity. I have a whole book on this stuff. One of the books, like when I wrote these books, some of the stuff in here, it's like all the stupid things that patients say that they hurt them. Brushing their hair. This lady, she's like, oh, I think I tore my rotator cuff. What'd you do? Well, I was brushing my hair. I'm like, are you Rapunzel? Like, who hurt? Like, what? Like, no, that doesn't hurt people, right? Picking up pencils doesn't hurt people. The guy told me, I blew 3 discs. No, you did. How'd you do that? Oh, I rolled over in bed. No, you didn't. My 10-year-old roll around in bed for 15 minutes, doesn't blow any discs. It's not that. It was you were predispositioned to have that happen. You just didn't know because it didn't what? It didn't hurt. So you were just oblivious. But guess what? You're oblivious to that tooth pain before it's tooth pain. You go in, oh, you got 3 cavities. I do. You're oblivious to your high blood pressure. You're oblivious to any of the positive tests on any of the I mean, there's people that go home on cancer treatment and have never had a symptom. And they're going to get chemo and stuff like that. Tests show you what's going on with people, not just your symptoms. So all these things tend to build up in the musculoskeletal realm. Every little thing that happens, it does a little bit of recalculating, a little bit less motion, less mobility, less range of motion. But you don't know because you're fine. It's like the guys in my golf league when I try to get them to come in. Here's their swing. I'm like, bro, your swing's terrible, man. You got no range of motion. You think you just hit it 100 yards. What club should I use? Doesn't freaking matter. You hit everyone 100 yards because this is you. They got no range of motion. Oh, I'm fine though. I don't hurt. Oh my God. This is what we're up against. They do not understand that it's not just because you're in pain. So once this gets bad enough and you drop into the symptom zone, here's what happens. Whatever they did right here, whoop, right as they drop below that, that's the cause. That's the picking up the pencil, the rolling over in bed, the brushing my hair. My favorite, the damn butterfly. So this lady comes in, her neck is like not moving and it's in a brace thing, like a soft collar. And I'm like, oh shit, she must have been in a car accident, like this is gonna be bad. I go, what did you do? She goes, well, I was at the Butterfly Museum and a butterfly flew by and I just went like that and looked at it and it hurt my neck. I'm like, didn't your doctor tell you, stay away from those butterflies? They are killing people left and right, man. They're dangerous creatures. Now, was it the butterfly? No, here's what it was. When we measured her range of motion in cervical rotation, you're supposed to have like 85, 90 degrees. She had about 20. So here's her deal. As long as she lives in 20, I feel good. Da, 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 da. And she got no problems. And I can tell her, you got a problem. No, I don't. I feel fine. As long as she lives in 20. But the minute anything goes boop beyond 20, what happens to her? Flared up. She's flared up every time she goes beyond 20. So driving her car, oh man, it's flared up again. And she can come in and we can work on her. We can make her feel better. But if we don't fix the 20, what happens? It just happens again. And you shouldn't be like surprised, like they're surprised by it. I can't believe this happened again. What the hell did you think was going to happen? You didn't fix why. You didn't fix the cause. You just made them feel better. They could have just done dope for that too. You didn't fix the range of motion, so of course it's coming back. I would expect it to come back as soon as you do something. And this is what we're seeing with patients all the time. They're doing things and then it's stirring it all back up because they're not getting to the cause. So here they are. They come into the office. They're down here hurting. We turn them around. And then as soon as they get right here, how do they feel? They feel great. And they have no symptoms. So they're like, enough of this bullshit, doc. I don't need to be coming no more. I think I'm good. And they're right here. And then when you say, okay. Now they go back out. And what do? Pick up another pencil, brush hair again, pick up their little tiny dog or whatever it is they're doing. Scoop and poop in the yard with the dog. I had a guy doing that. Oh man, I'm like, was that like an elephant poop you were scooping? You got a big dog, huh? Oh no, it's just a little. It wasn't that. So what happens when they're here and then they do the last straw again? They're so close to the line, the next thing they do, they're right back down in trouble again, but usually going to be a little bit worse because every time you flare it up, it's a little bit worse. So then they come in and go, well, last time it only took 7 visits. You know, now we're already at 14. What the hell? You suck now. No, it's because you made it worse. Your pattern is worse. You've got more scar tissue now. You've made it worse. And they do that over and over and over again. And it just spirals down. And usually they'll quit coming because they say it doesn't work anymore. What you're doing doesn't work. And it's not even that. what it is, what if, when they got here, instead of quitting, we allowed this to come up here as high as it could? And I say that because patients think you're saying that you're going to cure them and that you're going to fix all their problems. And so I have a few things that I say with that. Number one, as I always say, listen, you're not going to be 18 again. I also say, you're not living forever. Everybody's dying. Because they think you're saying that. They always think that. They would say that. Oh, you're saying you can fix that? I go, no, I'm not saying that. Here's what I'm saying. You're going to die, but we can help you on the journey there to have a better quality of life. You want that or not? But you ain't living. And I tell them, listen, all the apostles are dead, so I'm pretty sure you don't have no chance. Just saying.
You're talking about this life or the next?
Yeah, exactly. But it's because they think you're saying something that you're not. There's a thing out there that chiropractors think they can cure everything. So that's what they're attaching onto. So you have to handle that. And I always handle that. I'm like, hey, you're not going to be 18 again. No, not a chance, my friend. So we try to get your function up as high as it can go. Once it's up here, are they still going to do all these life events that got them down there in the first place? That's a hell yeah. They are. So here they go. And now you could just let this all go until it gets down there again, or what would be a smarter approach? What if we just pulled all that stress and tension out of those tissues and kept it up here all the time as they went through this thing called life? Wouldn't that be better for a quality of life? Now here's the question. How do they know where they are, and how do you know where they are? Because you can't base it on how they feel. How are you going to know? Because here and here feel the same. Remember the butterfly lady. How did we know she still had a problem? We measured her range of motion. So testing can show you where somebody is so that you know. If my range of motion is 20 degrees, do I have a problem? Even if I feel great?
Yes.
Yes. If I can't touch my heel to my butt, is my knee under risk? Do I have a problem? You better believe it. If I can't do Patrick's test laying on my back, if this does not come down to the table in a relaxed method and it's stuck up in the air like this, do I have a problem?
Yes.
You certainly do. Testing will show you. We have a whole battery of these that we do. How about Apley's? Apley's, if I can't do that, the farther apart my hands are, the higher risk I am of shoulder injury from the PT literature. So you can use that as a tool. So as a patient, when the patient comes in and I have them do that test, and then here's the magic. You can't, well you can, but it works better if you use things people already have agreement with. So do people have agreement with going to the doctor and getting tests done? Do they already do that? Do they get things shoved up in every orifice with no symptoms and joyously do it? They do. So they're already used to doing tests even when there's no symptoms. Do they go to the dentist when they feel great and have no symptoms? Yes, they do. They already do that. So it's an easy switch to mind shift them off of symptom care onto testing care. You should be coming so we can check your mobilities and your ranges of motion, and anything that's stiff and tight, we need to work on it. Because what happens when you're stiff and tight? Tell me what happens over the next 10 years. I wake up and I'm 80 and go, son of a bitch, look at me, I'm moving so much better than I did when I was 50. Ha ha! Does that ever happen? Hell no, it doesn't happen. You get stiffer as you get older no matter what. You're going to get so stiff you're going to be called rigor mortis because you're dead. It's not about the cure, it's about the journey. So our job, and this is your shifting, our job is to take the patient and move them from symptom care to testing and function care, because if I took a patient, here's futuring, and this is what I call the clone example. If you want to use something that really helps people understand, the clone example is great. This is a fantastic tool. So if I took you, cloned you, I had two of you, one of you, we measure all your ranges of motion and mobility. And anything that's stiff and tight, we're on it, and we get it to be as good as it can be. Because you could have traumas that it's never going to be normal, but get it as good as it can be. And then as you go through this thing called life, we're routinely checking and measuring and doing treatments, making recommendations to keep those motions good. And now 10 years go by and 20 years, and now you're 80. Look at that person's mobility. Now let's look at your clone. He says, screw all that, I'm just taking Tylenol. And he does that till he's 80. You look at the two hymns, and what do you see? Which one do you want to be?
The young one.
Now I've shifted him from a symptom management to a function management to get your body to work better and function better. And what's going to have the better outcome for the patient? I wrote this book, No Rocking Chairs, because one of my buddies, who is a retirement planner, he and I would smoke cigars and hang out. And one day he's sad. And I'm like, what are you sad about? He goes, oh, I went to a retirement party for my client. And I'm like, shouldn't you be happy about that? And he goes, well, yeah. I go, oh, you screwed up, didn't you? You invested in the wrong things. He goes, no, they're multimillionaires. The investments were sound. He goes, the sad part is 30 years ago we sat down and they gave me a dream board of everything they were going to do when they retired. And it was travel the world, take their grandkids to Disney. He was going to golf every day on the golf league. And they were even going to move on the golf course so that he could be out there all the time. And he goes, they are so immobile and in such poor physical ability, they can't do anything on their dream board. So they sacrificed to save all this money, and now they can't do one damn thing about it. He goes, they should have been doing what you say. I go, yeah, everyone should. They should be worried about their mobility, because it's the quality of getting to your casket that we are talking about. Now, who can argue with that? When you talk about symptoms, everybody can argue with you. But when I talk about with the public, and it should be with you all too, but when I talk to the public and I say we need to get you to your casket with the absolute best mobility so you're upright, doing everything you want to do, right up to the day you just drop dead. No nursing homes, no wheelchairs, try to do everything we can to minimize that stuff. Isn't that what you want? And so far today, 100% of every person I ask that to, they say, hell yeah, that's what I want. I just didn't know how to get it. I thought it was luck and chance. No, it's not luck and chance. It's are we measuring, paying attention, and then actively pursuing things that are going to help you with that mobility and keep it good. And then when they come, they're coming in, and we say, how's your body working? They say, great, I'm here to keep it that way. Find tightness and tension that's building up in me with your measurements and tools. Find where these tightnesses are that I don't even know because I don't feel them, and let's get working on them so I can keep moving, so I can do all the things I want to do in this short time we have life and get right to the end, living it to its fullest. And who the hell doesn't want that? Everybody wants that. You're just selling the wrong damn thing. They don't want the chiropractic lifestyle. Like, what the hell does that even mean? I'll just get adjusted for the health of it. Yeah, okay, there's 6 people that do that. Not enough to fill your practice. The bulk of them want mobility and function, and this stuff is easy to explain, like I just showed you. These are all the things we show the patients. They learn it. And then it's like, man, we have people that are coming and they're like, I had a lady this last week, she came in and she's like, Dr. Mike, look at this. And she can touch. And she was like this far on that shoulder test. And she's so proud. But her mobility's better. I had a pitcher from Grand Valley, which is a school in our area and college. And he came in, of course, you know, the young guys, no problems, they're studs. But his restriction on that test is about 16 inches. Bad, and he's a pitcher. So we work with him, and because he's young, fit, and it was fairly new. In a short period of time, we had him touching. He doesn't think it matters because he doesn't feel anything different because he didn't hurt. Well, then he comes in, he goes, hey, I just had a tournament this weekend. I'm like, oh, cool, how'd that go? He goes, I pitched the fastest I've ever pitched. He goes, I can't freaking believe it. Like, it's significant. I go, well, no shit. What do you think? Range of motion, of course you're going to throw farther, duh. I had a professional golfer come in. He's like, why are you here? He's like, I don't know, I just heard chiropractic's good for golfers. I go, well, let's measure your mobilities and let's see what we can do. He comes in so excited. I got 7 miles per hour on my swing speed, higher. I'm hitting the ball farther. Hell yeah, of course, duh. Range of motion, timing, neurology of all of the timing of you doing a thing like that, that's going to make you better. Who doesn't want that? Everybody does. They just don't freaking understand it. And we're beating our head against the wall. And when we let people think that their back popped out and you're popping it back in, you just set the whole house on freaking fire. And nobody's ever going to get results when they're doing that. You've got to stop that. You got to fix it so people don't think that. You start talking to them about mobility and function and keeping their body well. And then, if you really want to go in the deep end, Heidi Havoc has a really good seminar that I just watched online on how your nervous system can influence all of our internal organs and everything else. Because this is very, very muscle orthopedic based. But what happens when we do this nervous system stuff, oh man, watch out, shit happens. You have seen it. The crazy stuff. Kids that talk. I've had all kinds of weird things. I've seen positive effects that you don't even know how it worked. She's got a seminar that explains how it could. We don't know, and I don't really freaking care. I mean, it's cool if I can explain it to patients, if it's going to drive them in, that's all I care. If I can explain this so it drives them in so they get better results, then I need to know. If it doesn't matter, then it doesn't matter. But with that stuff with the brain, and then all of the sclerotogenous zones, everything where they're sharing, like, you know, you have a heart attack and your arm goes numb, it's not your heart. Your brain thinks or it's not your arm, it's your heart, but your brain thinks it's your arm, because that's what your brain is used to and accustomed to the pattern. There's all kinds of stuff like that going on in your body. I had a guy come in the other day. We did a treatment plan for him. He goes, I can't afford it, so we had to do a watered down treatment plan, doing the best we can in his budget. And then he comes in like a couple months later, he's like, hey, remember that treatment plan? I go, yeah. He goes, I'm ready to do it. And I go, oh, did you get a new job? You know, win the lottery? What the hell happened? He goes, no. He goes, since I've been coming, I haven't even had to take acid or allergy medication anymore. That too. He goes, I haven't taken allergy meds since I've come in. And I go, I didn't even know you took allergy meds. He goes, well, I didn't tell you because that's nothing to do with the bones in my back. Oh my God, dude. You just don't know what you're going to see. And I do see the acid reflux stuff all the time too, where people don't even tell you they have it, and then you're working on them, and all of a sudden they're like, hey, that's all better now. How the hell did that happen? Well, somehow your brain figured out a better communication way to get all of those things happening better through what we do. Through these resetting, every time those receptors reset, and that message goes to the brain, reset, reset. Could it spill over into other areas and cause resets in those areas too? Certainly could. That's how I think it works. I don't know though. But I do know this. This is how it works. It's not mysterious. Straight up. When you get people to understand those muscles and tissues, the brain patterning, you say compensation pattern, they already know what that means. You're using the footholds of what they already understand to build on top of the understanding you're trying to build. And you can build it well. All this stuff we've got figured out, it's all in our platform, because that's how you drive understanding. And those are the most fun patients to work with, because they get great results because they understand, and then they don't do dumb stuff. I have found, and you guys that have been doing this for a while too, your best patients are always the one who understands the best. And the ones that say, I don't frickin' care, just shut up and work on me, they always do dumb things, and then they don't get results, and then it's always your fault. And then I'm like, but you didn't do one thing I said. It's still your fault. So I operate off the, I know that's going to happen, so if you tell me you don't want to know, I'm going to make you know more. Because you're just going to blame me anyway and give me a 1 star, so I might as well go all in and try to save your ass from your stupid mistakes that you're going to make. It's worth the risk. Because when you don't and you just agree with them and let them do that and then they quit and then it comes back and they didn't understand how it could come back, because then once you go, you got to go forever. Well, yeah, right, because you don't fix what's wrong. But they don't understand it and then it's always on you. It's better to go all in, push them hard to get the understanding, and then let the cards fall where they lay, you know? I tell people, hey, it's your choice. I'm empowering you to choose. That's all I'm doing. You can make dumb decisions. And I've had people do that. I had a guy come in, he goes, I'm not even going to be alive in 10 years. He goes, I party like a rock star. He goes, I'm not even going to be around, so I don't care about none of this. Fair enough. Good luck, brother. You're not going to get them all. But there's a lot that you can. And there's a lot of people who need you. You just need to know what to say it, how to do some of these explanations to people. On our system, it's pretty exciting. We have a whole system. So like on our first visit, we do our evaluation, do all the measurements. Once you get all the measurements down, then you have your baseline. What that allows you to do is in the future, you can come back and redo all the measurements. Usually we do that after 12 visits. Why? Because that's how long muscles take to start to change. I high jumped at Michigan State a long time ago when I was much more fit and much more skinny. Jumped 6'11", and the trainers would take all of us as athletes and they would run you through a battery of tests. How quick can you run from here to there? 1 jump, 1 foot jump, 1, 2, 3 foot jump, a full run jump, and then you'd hit this little tool and it would measure how high you could go. And then they'd write all that down, and then they would customize a workout routine for each athlete that we would then do for a month, doing at least 3 times a week, and then they would retest it and see if we were making gains in our deficiencies. When I got in practice, I go, why the hell am I not doing that with patients? Because I can find their deficiencies. Once we find them, we can get a treatment plan with chiropractic and other rehab things to help them improve, because the product that I'm trying to get is that person's function higher and lasting longer with good quality right up to the day they die. That's the product. When I ask chiropractors, so I was teaching with Pro Adjuster group and I had a whole group, there's MDs there, PTs, medical people, but lots of chiros, and I asked them, I said, write down your product. And the chiropractors all wrote down adjustment. The massage therapists all wrote down massage. The medical people wrote down whatever things they were doing, whether it was injections or whatever. PTs, they all wrote down exercise. And I realized y'all got product confusion. The product that patients are coming for, they're not coming for an adjustment. They're coming for a solution to their perceived problem, which then you can use that to flip it and show them their real perceived problem is lasting to your casket. That's the real problem that everybody has. And while we're working on their symptoms and function, getting to the cause, restoring function and mobility, when your function improves, you never lose. If I went to any nursing home right now and said, who here wants a 20% improvement in your flexibility and mobility? Every hand goes up. Because they would rather live at home, and they can't. Everybody wants better motion and mobility. They can't argue that with you. They can't fight it. They all agree when you lay it out. Now you can help more people. You've just created this little 14% market of people coming for symptoms to get their back cracked back in place, to opening it up to a world much larger of people who want their mobility and function so that they can have the quality of life that they want. And that's an easier sell. And, in my opinion, way more valuable than doing a relief care cycle with somebody. Relief care cycles, just don't do it. That is this. doing this over and over and over and over as a relief care cycle, never getting to the cause, usually a range of motion restriction. That is a relief care cycle, and that leads to big problems. One of them being degenerative arthritis. So most people in the public, when we talk to them, and you talk about degenerative arthritis, how much time do I got? Oh, like 1 minute? Oh, I'm over? All right, I got way more. Degenerative arthritis is a huge thing, but the public, why do you think they have it? What's the cause? Age. They all say age. And I always tell the story, this has happened numerous times. The guy comes in, his hip's worn out, he wants my opinion because they want to do a hip replacement. And then I ask him, oh, why did they tell you your hip's worn out? And what's the answer every time? Age. He's old. And I go, interesting, how's your other hip? Well, there's nothing wrong with that one. Well, how the hell old's that one? Why would one hip wear out from age and the other one doesn't? They're the same age. That makes zero sense. So if you took your car into the mechanic and you go, look at this tire, it's all worn out. And he goes, son of a bitch, you must have got an old one. You wouldn't buy that for 2 seconds. You'd know the alignment of the car is causing that tire to wear out. And if you pulled that tire off and just slapped a new one on and you drove away, that new one would wear out too. What do you see with hip replacements? Often, do they last forever? Why do you think they wear out? Because they didn't do anything to address the musculoskeletal compensation pattern, neurologically made, enforced by the muscles, that put pressure into that, causing that to wear out at a faster rate. It's not age. Oh my gosh. If it was, every joint in your entire body would be worn out the same. Oh, look, my little finger. Oh, C1. Oh, my knee. Everything would be the exact same. It's not. It never is. It's always under areas where there's joint compression from the muscle and the pattern, which we've been talking about. And you can identify those risk factors with measurements. So what do you think? If I do heel to butt and I can't do it, what muscle is tight? Quad. What does it cross over? What joint? Knee. What do you think's happening to the joint space in the knee when the muscle's so tight I can't even bend it? What do you think's happening to that? It's short, compressing that joint space. And that cartilage is then under compressive force and wears at a faster rate, asymptomatically. What if you measured everybody, just that, and you watched that, and every time something tightened up, oop, you were on it. Oh, tighten up, oop, I'm on it. Measure, measure, oh, look, on it, on it, on it, on it, on it. And you did that till they're 80. You think they'd have less chance of that wearing out than if they just take Tylenol and do nothing? Hell yeah, they do. Does it mean you're 100%? Nothing's 100%. Get over that. Nothing's cured. Everybody's dying. There's no cure. It's the quality of your journey, and that's what we're talking about. If you want help with any of this stuff, I have our platform that we, at our booth, you can sign up, get access to that. You can get on the platform. I have all this stuff and more. I didn't think I had enough. I'm like, I got so much material, I could do this all day. There's so much. But it's all trying to help you shift from symptoms to function. For you to shift in your mind that you got to get out of your frickin' basement and get out into the public and then talk the way the public understands, not Chiro speak. Chiro speak doesn't bring them in, but talking to the public does. And you have a lot of people to help. And we want to see you help them because the miracles are in your hands and you guys can do it. And I'm excited to see you succeed. So thank you for your time. Thank you for being here, guys. Appreciate all of you. If you got questions, let me know. I do have a couple of my books if somebody wants a copy.